Okay, now we are going to start with Professor Green, who has taken all of the questions that you have sent in to Daphna, and he's going to tell us what he wants to tell us, okay, based on that. Manfred, you're on.
Daphne, do you have the questions up that we can put them up, or do you have them with you? I'm trying to see where I put them. I had them on a...
I sent you, they're in that document that I can share.
I've got them on a document, but I'm not sure I guess I could share it with you. Let me just quickly.
Basically, it's the questions that we collected for your videos. And
I've got them here.
Okay.
Let me just see whether I can, although it's not the ideal thing to do. Let's say go share screen. And let's see if this comes up. Can you see something from that?
Yes. Yep.
So you can see some questions there, right?
Yep. What is your take on the reports of reinfection?
Okay, I'm going to go through this very quickly because we don't have too much time. You've probably seen that that's now been, the reinfection that was seemed to be seen in Korea and so on is probably not reinfection. It's basically the remnants of the virus that can still be detected by PCR, because the PCR detects the genetic component, and it's probably not infective. So it's probably not, it's not now believed to have been reinfection. When might we be able to travel again domestically? Well, that's again going to be much related to the policies that are going to be undertaken. Maybe I'll just make a mention of it. There are two approaches, and you've mentioned it. And I knew there's an article, a short article in the Lancet now, which is a kind of, I'm wondering why they published it, because it didn't seem very scientific, but it's someone actually that I know who was at the European CDC. And he talking about Sweden and saying that in Sweden, they basically, he claims that something like 25% have already had been infected, and almost 98% don't even remember being infected. And it's an inevitable thing. Well, just let me give you a figure. Sweden's had about 2,800 cases now. If you take, and let's assume that 20 or 25% have been infected. I'm not sure that figure is correct, but let's assume. So let's assume that everybody gets infected. That'll take it up round to about 10,000 deaths. So if you say that, okay, and their population is just very similar to Israel, the size. So if you say, okay, we'll go through this and we'll have 10,000 deaths this year. And that's 10,000 deaths will make it virtually the leading cause of death here. Mainly, again, in elderly people, but most deaths are in elderly people. That's a question whether the population, the society is prepared to accept that. Apparently, Sweden is prepared to accept that. Sweden says, let's just go for it, and whoever dies, dies. And that's essentially, I think Manuela said that was what Boris Johnson said. So it's a cultural thing, which is not shared very universally, and I'm not sure how it is, but I think that if you multiply these up, and the numbers could be much greater in the United Kingdom, it could go into the hundreds of thousands, and certainly so it just depends whether the society says, okay, we'll have, the US will say we'll have 200 or 300,000 deaths, extra deaths, and we'll go through it. It's just so that's what's going to be. So the domestic and international travel is going to be to what extent we think it's going to increase cases, and they'll probably start it and try and introduce some kind of distancing there, which is going to be very difficult. How long until an infected person doesn't carry the virus anymore? This has just been extended. We used to say now that anyone who has recovered, we would take something like 6 days from or 10 days from the onset of symptoms and 4 days from full recovery. It's now been extended a little because, but it seems that once the symptoms are in, after 10 days, they don't seem to be really effective. So that's pretty much what we know about what's happening now. That's what's happening when people are basically considered to be cured or released from hospital, or not cured in the sense that cured is the stopping of the symptoms, but releasing them from isolation would be that kind of 10 days figure. 10 days from the, it's a difficult way of doing it, 10 days from the time that you recover, basically, but it may be a bit less than that. Why is it expected that summer months? This is what I was going to show you, but I don't think we have any time left, so we'll do it another time if you have. I actually prepared a small presentation on the seasonality, but we'll see if you want to wait, stay on a little longer. I can show you, otherwise we can do it another time. How are the cases counted? Are they only laboratory cases? They're only laboratory cases, and that's true. And the clinical cases are not counted unless they've been confirmed with PCR. This will probably change as the more and more cases are. They're not, the agreement now is not to change it, otherwise we'll change the numbers. So that, you know, everybody's following the numbers and seeing who's gone up and who's staying stable and so on. And if we change the definition, it's going to be a problem. So at the moment, it's only laboratory confirmed cases. There are lots that are around that were not confirmed, and they obviously are the definitions. The definitions are similar here in terms of a case, but countries have different policies of who they test. Some test only the more severe cases and some the mild. Sweden, for example, is only testing more severe cases. They're not testing mild. And in the UK, they started that as well. So you have a problem there of comparing who is being tested. So basically, Germany was testing just about everyone. So there are a lot of cases, but they were testing even the mildest cases, very mild. Is it recommended to wear gloves? No. They don't do anything for you. They just make a mess. You don't wash your hands when you wear gloves, and it's not a good idea. And maybe people working in supermarkets and things like that, or pharmacies, should wear gloves. When they should take their gloves off frequently, though. But there's no point in you wearing gloves. They get dirty and they can contaminate just like your hands. Better to keep your hands clean, and that's it. Vaccines are developed differently. There is collaboration between them. There's also a lot of competition. Somebody has claimed now that they should actually give up their patent. In other words, they should provide it free. I'm not sure that that's ever going to happen. People gave the example of Salk when he produced the polio vaccine. He actually he didn't get a patent on it. He didn't ask for a patent on it. He said it's something that he'll give free. But you have to remember that Salk subsequently married the ex-lover of Picasso, and his apartment is full of Picasso paintings, so he was not short of money. Were there any other questions? Let's see if we still have a couple of minutes for other questions.
There were two others that were sent to me, but they're a bit long.
Well, just give me the first few words and I'll see if I can help you on it.
Okay, this was like an essay. In the US, Medicaid has now been giving hospitals a substantial amount of money for admitting new patients with COVID-19, and even more so if those patients are ventilated. The CDC has also stated that in the event of a death, regardless of whether a positive test has been given, doctors are able to list COVID-19 as cause of death if it is probable and at their own discretion. How does this affect what we see as a global burden of this virus, and with citizens already having little trust in the healthcare system? How do we approach it? Yeah, there's
I can answer that quickly. Well, I'll answer it quickly. The one is health services. You asked my opinion. My solution, basically, as I say, is if people think they can get good health care and we maintain reasonable social or physical distancing, then I think we could cope with it a lot better. I would actually, if I was in Israel, if I was head of the health system and head of I would build new hospitals now. I would start to build 3 new hospitals, one in the south, one in the center, one in Jerusalem, one in the center, only for corona patients. Don't let any corona patients go to the general hospitals. Build for infectious disease hospitals. And I would recommend they do that in the United States as well. So you say to me, well, how much is that going to cost? Well, let's assume that in the United States, there are 50 states, and I don't know what it costs to build. They have very simple hospitals, by the way. They only need basic supportive treatment, some intensive care, and so on. You don't need operating theaters. You don't need any of it. And you need basic laboratory. So I don't know what it will cost there, but if you put into, if you spend 50 billion, gave each state $1 billion, or I don't know, $2 billion, they could probably build a few of these hospitals with that money. What is it costing us to do the lockdown at the moment? It's probably about a week of the lockdown, or maybe less, that's actually being lost in that term. But the decision makers probably will not do it because this is a proactive thing. You know, here they're saying we're losing money because we've locked down. That's not our choice. If I say, no, okay, give me money to build these hospitals and provide this stuff. By the way, this is not a new idea. This is what happened many years back when they had infectious disease hospitals. That was in fact, and in fact, even in Israel, there was an infectious disease hospital. And where I grew up in South Africa, where there were infectious disease hospitals, most of them have been closed. But I think we should go back to that. So that if somebody gets corona now, they go to an infectious disease hospital and get the best treatment possible. And if you don't have corona, you go and get your treatment somewhere else, and you're not afraid of going. Because what's happening now is that people are afraid to go to a regular hospital and get treatment, and that's going to be a big price that we're going to be paying right now. So that's basically the issue here. With there were two. There was one other. One was on the health services, and the second one was defining, coding a cause of death. It's very difficult in very elderly people who have multiple other diseases to decide what was the cause of death. So there's probably been a certain amount of what we would call misclassification. There are people who had coronavirus but died of something else. And so that's something that will only be able to be sorted out later, and it'll be different in different countries. It's going to be different for younger people. So most of the causes of death, most of the corona deaths in younger people are probably corona. You know, somebody who's 92 years old and has several other comorbidities, it's probably going to be difficult to know whether the corona killed them or they died with it. So that's going to be an issue of counting, if you like. There was another question, and was there one other?
Yeah, there's one below it. I don't know if we have time, but let's see. It said, as countries are looking to lift restrictions, some businesses are beginning to worry that employees might be able to sue if they're required to come to work and catch COVID-19 by doing so. What sort of implications?
Right. It's that, I know there's a discussion about whether that can be called a work accident and so on. And there's a long discussion now with the insurance, I'm sure. It's going to be different in every country, but it's an issue. Whether you can claim that you actually got sick because of your workplace, and then there's going to be a whole issue of workers' compensation. Probably because it'll be common, they may agree to compensation, but the compensation will be very small. In other words, you'll get $1,000 or something. You know, you won't get 100,000 or whatever. That's what I guess will happen. So it'll be a sort of a token sort of compensation. I think we needed to stop, right? Because otherwise, I do have a short presentation, but otherwise, can you give it another time? I mean, it doesn't have to be today.
Okay.
What do you feel? You're bored, tired, you want to go? We'll make another session.
Manfred, could you just take a couple minutes and not do the PowerPoint, but just tell us the key issues, and some people.
The difficulty is if you don't see, because it's all figures basically. It's not numbers. So you need to see the figures basically. So I was going to talk about the seasonality, but it takes a bit of time. So it's basically an assessment of the other coronavirus that we know about and how they behave, and what we can learn about them as to what is likely to happen in the fall and in the winter. And that's basically what we're studying at the moment.
Why don't I suggest this? Some people have already had to go. I know we have the admissions committee that needs to stay. But Manfred, maybe for the people who want to see this, why don't you go ahead and do it? And there's no.
Let me ask you whether there's not a problem for us to organize another session next week, because there'll be other issues that'll come up. Okay. So we could do it like a 1-hour session or whatever. We can do it next week and then I'll be able to provide you with more stuff, because there's quite a lot to discuss this. So I think it's pretty not to, there are a lot of things that we've got a few research projects that we're already starting to work on. That's kind of interesting.
Just note that next week we have the other two committees meeting back to back. So
we have to
we'll figure it out. Yeah.
Okay.
So if you can, I think that's
okay.
Good.
We'll work on a time for that.
Okay.
So
Great.
I'm going to suggest that the admissions committee stay on this call, and we'll say goodbye to everybody else. How's that? We won't reconvene on a different
Okay.
Zoom. Let's just do it on this, okay? Thank you, everybody, and we'll see you again soon, okay?
Manuela, I'm fixing your stuff. Sorry about it taking time. It's all okay. I just wanted to apologize because it's been taking me time to try and get the computing right. But it's okay, so you don't have to worry. Okay.
Okay, it's good to see everybody.
Thank you very much.
Goodbye.
Bye.
Professor Schuster, Dr. Green, I just wanted to give like a brief update that I'm probably going to do the AP with Vanya's organization also, but I'll write you a proper email, just a
Okay,
brief
good.
update.
I spoke with her earlier, Adi, and she was very excited about you joining her. We did a test run of Zoom earlier.
Oh, okay.
Okay.
Yeah.
Good, excellent.
I'm going to leave now. Bye-bye. Thank
Okay,
you
goodbye.
for everything.
Thank you.
Bye.
All right. Now we have